So now that we've got our client in supine, we're going to apply some muscle energy technique using a post-isometric relaxation version of the technique to the hamstrings. As you can see, I've taken away any bolstering from his knees, knowing that he is okay for this next couple of minutes to sustain not having support underneath here for his lower back. And that's purely for the purposes of the pelvic alignment at this point for this particular move that we're about to do. So in order for us to administer this, I'm going to just have you bend your knee there, Paul. Thank you. And just towel my client appropriately and allow your leg to come back down. Now, normally, and this is what I'll teach on our course, that normally with any muscle energy technique, I want to test the range of motion on both sides. And I want to do actively and passively to get a comparison of a baseline for your client. So that's part of your assessment as well. However, for the purposes of today, we're just going to look at working with the leg that we're going to be treating. So as long as my client is able to lift this long lever on their own, I'm going to ask them to do this because it does put a lot of pressure onto the lower back if I'm going to ask my client to lift their leg here. So you just need to be mindful of that. So Paul, when I ask you to, I'm going to get you just to lift this leg as far as it feels comfortable to go, okay? And I'm going to help you a little bit. So I am going to support his leg, but I'm not going to force the movement. Okay, when you're ready, nice and slow. That's it. Good. And then slowly back down. And then now I'm going to lift your leg. Let me take the weight. I'm going to take it just through range and see what we've got here. So now I'm going to do a passive range. Nice and heavy with that leg. That's it. And I'm supporting the knee. And I'm holding behind the ankle as well. So what am I looking for here? I'm looking for what point does the knee start to bend or want to bend? I can also feel the tension under my hand from the distal hamstrings as well. But I'm also looking for that quality of movement. So about actually here is where I feel that Paul is going to be. And this is where we're probably going to start our first MET. Could I go further with him? Absolutely, but again, his knee starting to want it to go into flexion, which indicates a little bit of restriction through those hamstrings there. So I'm going to place his leg back down. Now, to set myself up for this properly, because I'm going to be here for some time, and the limb's quite heavy, so I need to protect myself and my own body mechanics. So what can I do? Right. Well, initially, I'm going to find where Paul's first barrier is. Okay, that's nice and heavy. Good. And I'm actually going to use my shoulder for this one. So it's relatively nice and easy here. And I can just move and shimmy my legs. There we go. Okay. So, Paul, when I ask you to, I'm going to get you just to engage your leg by pushing the back of your leg down into me ever so slightly. Just like maybe 10%, but even less. Just like an initiation of a push. Because what we're looking for here is typically what we would say is a 10% contraction. That 10% could differ for a multitude of people. So you need to find language that resonates with your client. The other thing is here as well, I want to make sure that I'm supporting his limbs. I want to make sure I'm not taking the leg out to the side. So I really need to make sure that that thigh is staying in line with the joint. His knee joint is protected. So again, if you're working with a hypermobile client, well, this is even more applicable in this situation as well. And as well with that activation of the contraction. I was very descriptive because again, like we said, that contraction can differ for many people. So it's just an initiation. You want to feel those muscles just fire up. All right, so when you're ready, Paul, if you want to just push that back of the leg down, that's it, beautiful. And we're going to hold it for 10 seconds. So we're asking him to engage the hamstrings through an isometric contraction here. And once the 10 seconds are up, Paul, can you just let that contraction go? Let the leg be heavy. There we go. So once you can feel that the client is, you can palpate it and you also notice that they fully let go, you can move it into the next barrier or area that you feel that the tension is starting to build up again in those hamstrings. We're going to hang out here for another 10 seconds. The movements are very subtle. Take your time with them. Rest here for 10 seconds and then we're going to engage again for another 10 seconds. So gently push down for me. That's it. And we're going to hold that contraction for 10 again. And then once it's up, let that contraction go. And you have up to 10 seconds to move this leg again. So give yourself a little bit of time. And then once that contraction has fully been released, we're going to go nice and heavy with your leg there. That's it. Good. Going to stay here. One last go. Paul, push down into me. That's it. And you can count out loud with your client so they know when they might need to let go. And then that's it. 2, 1. Let that contraction go. Now for Paul, that's probably my last time that I'm going to do it. So this next one is going to be the last barrier. I'm just going to move down. And I'm going to stay here for 20 seconds. I'm just going to let that leg rest here for 20 seconds in its last barrier or last new range. Good, and then I'm going to slowly come out of it and support his leg coming down. Now from here, I'm going to ask him to take his leg actively through that range again. We're going to retest. We're looking for range, but we're also looking for quality of movement in this as well. So again, remembering to support nice and heavy with the leg. You're going to move your leg yourself, but let's go through that range. Good, and back down. And then for me this time now, let me take your leg and let me take it all the way through its range. Lovely. Okay, and as we can see there, quality of movement felt much nicer, more fluid on my end as well. And for me, I noticed that he did gain a little bit more end range there as well. So that was a really nice demonstration of muscle energy technique, post-isometric relaxation version for the hamstrings and for our runners.